General Russell helped build an environment that allowed people to be successful. And I think that was really his endearing quality.
I first met Phil in January 2002. I was warned about meeting General Russell, the curmudgeonly retired Army general. And to this day, I am trying to pay forward all that I have learned from this amazing man.
Phil Russell was a very dynamic person. You picked up very quickly, as soon as you met him, that this guy knew what he was doing.
It wasn't just his charisma. It wasn't just his reputation for integrity. It wasn't just his intellect. It was all those factors. Phil didn't have to speak a lot. He could speak a little, but he got a lot done as a result.
The fact that he was such a unique person made him sought after by different organizations, to include Sabin, to include the Department of Defense. So when we had problems in 2002 with biodefense issues, well, Phil was brought back in again to provide advice and guidance.
The FBI is investigating anthrax exposures in Florida, in New York, here in Washington, D.C., and elsewhere around the country where...
In the wake of 9/11, the anthrax attacks, we were vulnerable. We weren't ready. And the products we needed, the life-saving products, vaccines and drugs needed, the cupboards were empty. There was none, and there was nowhere to go to get them. In that moment of historical sort of crisis, Phil was needed, and he answered the call. What we prioritized were getting a smallpox vaccine and getting an anthrax vaccine. And what we realized 20 years later, those programs set the foundation for what is now Operation Warp Speed.
He was someone who came out of the military in his senior leadership role at Walter Reed Army Institute of Research, and probably knew more about making vaccines than just about anyone.
I was offered an opportunity to take a regular Army commission and go to the University of Maryland for residency training in internal medicine. There was no infectious disease training, formal infectious disease training in those days, but Dr. Woodward's department was about as close as you could come to a pure infectious disease training program. So I went off to Maryland. The next year I was sent to Lahore with the University of Maryland team for, I think, 16 months. 1963, 64, I spent in West Pakistan, and there I got really fascinating clinical experience, clinical malaria. At that time, the seasonal epidemics of both Vivax and falciparum malaria came every year in the Punjab. Quilosophaces transmitted malaria. Sandfly fever was not uncommon. There were smallpox epidemics in the villages, a lot of rabies, West Nile fever. It was a really exciting year in terms of learning clinical tropical medicine.
He understood that if it was going to make a difference, it had to go all the way to the clinical testing. Does this vaccine work? Yes or no?
Essentially, he was an optimist and saw how the world could become a better place. And that's really what drove him, how he could develop vaccines that would improve health around the world. And it wasn't surprising that he was invited to many places for that influence.
I first met Phil Russell in 1959. We had a lot of laboratory experience from working at the Army lab in Washington. One of the activities that Phil and I started on together was to build dengue vaccines. That's a thread that goes through our entire lives.
Dr. Russell had this profound and deep familiarity with the whole vaccine ecosystem, all the way from the science to the regulatory aspects to the whole international geopolitics and political relations. And he learned this because he was very important in setting up the Children's Vaccine Initiative, what ultimately became Gavi, the Global Alliance for Vaccines and Immunization, which is arguably one of the most successful global public health programs ever invented.
The Children's Vaccine Initiative was an effort to jumpstart a new group of vaccines and a new process of identifying vaccines to be given for children.
The Children's Vaccine Initiative clearly had a vaccine development, research and development component to it. And that's where Phil came in, given his vast experience in the Army of doing vaccine development work.
When you're an Army officer, when you're promoted to Major General, you're in the business of getting things done.
I remember one instance where we got a call one day, and it was an emergency meeting that Phil Russell was calling up at Fort Detrick. And it had to do with an unusual incident that was happening in Northern Virginia. There's a research primate facility there that had monkeys dying. The suspicion was they were dying from SIV, except for one thing. It wasn't SIV, it was Ebola. And Phil recognized that very early and said, we have to step forward, because if we don't stop this, we're going to have a major public health catastrophe. That's the kind of stuff about Phil Russell that's so important. Not being afraid to step forward, making the right decisions at the right time, just doing the right thing.
During the early 80s, the Medical Corps of IDF and the United States Army Medical and Research Command initiated joint meetings. And that was my initial meeting with Phil Russell. The main achievements in the vaccine field was vaccines fighting diarrheal diseases, as well as the hepatitis A vaccine. This was a major step forward, because today we almost have no hepatitis A and very, very few cases of bacillary dysentery.
PaxVax was a privately held, venture capital-backed biotech company developing new vaccine platforms. Without Phil Russell's help, I don't think that we would have had necessarily not just the acumen to design the development program well, but also the credibility to then go talk to other parties in government and at various foundations, the Gates Foundation and the Wellcome Trust, to then get funding for those programs, which we did.
Phil had this brilliant sort of balance of being the general and clearly having command and control of the mission, yet he was such a human leader.
He had a habit in the laboratory of not staying in his office. He would wander across the laboratory. It was not unlike him to stop in different offices unannounced, sit down in a chair across you at the desk and say, okay, tell me what you're doing and let me know what I need to know.
I'd barely put my head up when I was at work during the day, and he would force me. He would come over and he would grab me and he said, Monique, we're going to go out and get a hot dog. We went and got a hot dog on the corner of Independence where we could just catch our breath. And that's in part where I think the legacy of General Russell, of Phil, came through in what he would share with me. I'd get a better sense of how he led.
Phil became my confidant and my mentor. He helped me relaunch the entire R&D team at Sabin and refocus our strategy. And I really owe a great deal of my own success at Sabin to Phil. I wouldn't be here without him today. He was an unbelievable man and a lovely friend.
Phil joined me in Bern, Switzerland for the grand opening of PaxVax's new headquarters there to produce vaccines. And we had to invite an incredibly wide swath, if you will, of society. And to see him interacting with a local pharma, at the same time, we'd be talking to the ambassador to Switzerland a few moments later, and then in turn talking to some Wall Street banker. So Phil had an amazing ability to relate to human beings.
He wanted to enjoy life and every aspect of it, but he also wanted others to enjoy it as well. Join in and have the fun.
He loved to share his friends, his colleagues, his family. He recognized that no one person can do this, that to do important things, you need a whole ecosystem.
Every conversation I had with Phil showed that he had a vast encyclopedia of knowledge. It could be about bird watching, or the way that HVAC systems work, or how to plant a garden, or how to build a vaccine.
And I just remember thinking that from the very first time I met him, hey, this is a person I want in my life, and I could learn so much from him. And that turned out to be the case with Phil. not only from science, but also how to behave as a scientist.
Phil occupied the highest domain in the Army of decision making and medical research. Somebody who was early in the history of modern virology, somebody who had experience and had command and had decision making ability. And then he went on to direct and guide the Children's Vaccine Initiative. You couldn't ask for a better and more significant, wonderful career.